Good evening, everybody. Welcome to another Orem Academy podcast. My name is Robert Hawkins. I'm VP of Business Development with the Orem Group. We're going to get started pretty promptly at the top of the hour here. So, thanks for joining us. And just a little quickly for everyone here as well too, as we get going with these gentlemen, they're going to get into the pocket, into the flow. So we do have the Q&A function with the chat and the chat as well too. So if you do have questions, please put them in the chat and in the Q&A function, and from there we will answer them at the end of the program this evening. So. With that being said, we are going to get going. And so, Dr. Khanna, if you would like to share your screen and kick us off, I'd be happy to introduce these three gentlemen, and then we'll get underway. So, thank you to these three gentlemen for all of you joining us here tonight, and sorry, not sorry for hounding your inboxes and your social media feeds with this program, but it truly is something that can impact everyone in dentistry, no matter what discipline you're in, what type of practice you run. The ORAQ solution has relevancy to everyone. And so, the Orem Group, we're proud to have a commercialization agreement and partnership with these three gentlemen and ORAQ. And so we really believe in this product, and we're excited for you all to see it. So smarter hygiene, stronger recalls, and faster growth, how clinical AI and risk-based intelligence are transforming hygiene and day-to-day dentistry. Three of the gentlemen who have founded ORAQ are these three gentlemen here. Dr. Amrish Khanna, he's a data junkie, a dental nerd, and an entrepreneur, 18 years in the clinical, multi-practice owner. He is the CEO and founder of ORAQ, Adept Dental Education, and a wonderful cause with Cause to Smile. And he's a pretty good golfer as well, too. And then we also have Dr. Kolbir Manas, graduated from U of T Dental in 1999. He loves working as a periodontist, as an ORAQ AI clinical consultant, married with two wonderful children, so is striving to stay relevant for another 4 decades. Kolbir, come on, more than that, at least five, six, maybe something
I
like that.
put or more, so we'll
There
see.
you go.
Depends on if
Perfect.
AI can keep me alive in the future.
Exactly. Yeah. 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 I see you building those agents. And then last but not certainly not least, we have Dr. Mike Parchewski. He's a podcaster, a lecturer, a key opinion leader. He's the chief clinical officer for Passion Dental Group and ORAQ. He's founder and mentor of the Passion U Implant Study Club, among several others, which we're proud to be a part of. He's also known as ORAQ Vest Guy. And I'm out of breath, and I'm really pleased to have the three of you gentlemen here. So without further ado, take it away. Can't wait. Thank you.
Thank you so much. And Mike's also given me a couple of golfing tips over the years too. So there you go, right? But yeah, awesome. Really excited to be here all through this evening with all of you. Thank you very much to the Orem team, Robert and Tanya, for setting this up and for our partnership. Really grateful to be working with all of you. And yeah, we're very excited for all the participants who've taken the time out of their evening today to spend some time with us and learn about clinical AI in action. So we've got a fun evening packed here to talk about multiple different things that we're going to be sharing around what's happening in clinical AI and specifically ORAQ. So I'm going to jump into it here. So in terms of what we're hoping to cover this evening here, from a learning objective perspective, really talking about kind of these five pillars of how we're going to identify and talk about risk-based assessments for patients, how key clinical information and the data is really important to be able to provide an overall decision-making framework for patient evaluation and a communication tool so you can really help talk to your patients about what's going on in their health and help increase case acceptance for the right care at the right time for the right reasons. So, as Robert shared with all of us here, we are all involved in ORAQ, clinicians and educators, practice owners, multiple hats that we all wear. But today, this evening is really focused on also sharing about what we're doing with our solution, how we're looking at AI in dentistry, but also just talking about AI and dentistry as a whole, and then specifically honing in on what does this look like in action with the ORAQ solution. But we've been in an interesting time here over the past decade or so in dentistry, where dentistry has evolved a ton from, technological evolutions all the way from digital charting to X-ray to 3D imaging, intraoral scans, CBCT, and now dental AI. And there's a lot of these new dental AI applications out there. But what we found is that none of these systems still connect and unify the patient as a whole. So the patient sits at the center of this, and all this evolution has given us great diagnostic tools, but it gives us multiple different systems that we have to look at, evaluate, and understand when we're trying to evaluate our patient. And how do we piece all these things together is all really left to individual interpretation up in here. So that's the hard part. So this evolution has given us so much valuable information when it comes to evaluating our patient, but at the same time, it creates these silos and disconnect from our patients that we have to tackle. When it comes to the day-to-day of dentistry, I mean, running a practice, dealing with staff, dealing with our patients day in, day out, there's so many things going through our mind. Our kids maybe kept us up through the night too. So there's a lot of things in our day-to-day. So when we're talking about this data explosion that, we're seeing from a clinician perspective, we still have to manage all these things day to day. And again, it's all has to be processed real time by our own intelligence right in here. This is why this is such an opportune time for AI. And if we look at the state of the dental industry today, every time a patient lays down in our dental chair today, there's almost 6 to 10 of these siloed data sets that we have to actually look at and piece together and juggle in real time. When we look at the continued models of group dentistry, there's over an 80+% chance now that a patient will see a different dentist or different hygienist all within the same practice location. So this is why now is the opportune time for AI, because AI and technology is really here and poised in a wonderful way to be able to start connecting this data, reduce that provider variability. Because when we've studied this through our company, we've quantified this to actually leaving $1 million of missed care opportunities on the table in a practice annually. So a lot of dollars being left in the table. And that means missed care opportunities, missed opportunities for early intervention and alignment with what patients truly understand. So AI is the number one trend in dentistry still over the next 3 to 5 years. And dentists love their technology. So this is one of those many solutions that dentists are really evaluating and looking at today. So I truly believe we are at a Kodak moment for dentistry, where Kodak resisted and failed. And, we have an opportunity here to really adapt and grow and really shape this future together. So where we can be clinicians with our AI partners. When we talk about what is AI, just to touch very briefly on this, I mean, there's a lot to AI. You hear all these different terms today when it comes to ML, LLMs, Gen AI, agentic AI. There's all these different things, but essentially AI is just these are different analytical models that are taking in data, processing data through some type of a model, whether it be imaging data, whether it be text data, and then generating some form of an output. So all of these different layers are here to take a task that we're tasking the model with to say we want to achieve this outcome, and different models and different ways of thinking around these models are there to process different types of data to give the intended outcome that we're looking for. I put this circle around the whole thing, calling workflow automation, because technology in general is not just about utilizing AI, it's about using technology to automate tasks that take us away from what's most important, which is patient care. Right. And sometimes we can actually utilize these technologies, these types of models, or just technology in general, even outside AI, to automate tasks that take time away from what's truly important. And that's what is the exciting piece about putting all of this together. And when we talk about why AI today, right now, our patients are walking in the door, moving from an era of what we used to call Dr. Google to really Dr. Chat GPT now. So OpenAI earlier this year launched a healthcare specific model. And what they said was there's over 230 million people globally that are asking health and wellness connections every week to ChatGPT. So this is crazy. So this is changing the way our patients function and our patients come in the door. So they're being equipped with a lot more information that is way better than Dr. Google was. And so they're coming in the door to be, asking us questions, or already equipped with some background information. Whether it's right or wrong and all that stuff is still always a debate. But this is why we have to be change leaders, and we got to think about using AI within our practices today to really be forging the future together. When we look at AI across the entire dental practice, I mean, there's a lot of these different buckets here We're looking at AI on the administrative side. There's phone call AI, phone call agents, so you don't miss a call. There's AI in operational systems, recall reminder systems, and so on. There's AI for internal training, standards of practices, things like that. There's image diagnostic AI. Some of you might be using AI that's evaluating your X-rays or your CBCT. The bottom left here, there's a lot of AI when it comes to the lab work that we do, or monitoring of orthodontic treatment, for example. Like, how are we doing real-time crown design, what our labs are using from CAD design, and so on as well. Marketing is changing the world of, of SEO to what's now called GEO, generative engine optimization. Again, a lot of AI happening in there too. How do we be at the top of that AI search now for our patients? And lastly, clinical decision support and treatment planning and notes. So this is really right at the clinical, when you're in the chair, what's happening? What is this intelligence doing in the background, whether it's helping you with your note taking or what we're going to share with you today, our clinical intelligence platform, which is ORAQ. So what is a clinical decision support system? And a clinical decision support system is a system that is really taking a whole multitude of clinical data and comparing it against clinical knowledge bases, guidelines, or AI models to deliver recommendations, reminders, or alerts. So the purpose of a clinical decision support system is not there to replace the expertise of a dentist or a doctor, but to enhance the decision making. Because back when we talked about, in a few slides back, I was saying there's so many of these silos, there's so many of these diagnostic systems that rely on us to know how to interpret it in here, and we all interpret it differently sometimes. So how can we look at all of that information, have it at our fingertips, and get the information that we need, which helps us talk about potential risks or red flags with the patient, suggest evidence-based treatment options, and so on. So a funny little video here for anybody that's a Scrubs fan and is watching the latest season. This one's for you.
In medicine today, technologies like artificial intelligence have pretty much taken over. Is fluconazole contradicted with olanzapine and sotalol?
Fluconazole is contraindicated.
Mr. Miller, I realize fluconazole interact with your other meds. I'll find an alternative.
I don't know how doctors keep all that stuff in their head.
I know, it's crazy.
Would you like to know more about fluconazole?
I already handled that, nurse. It seemed like AI had answers for everything around here, except maybe those two.
So you can see, again, this is just a fun application of how a clinical decision support is being used. So when we have patients in our chair, I mean, this patient's got a lot going on. You can see a broken tooth, missing tooth, chipped tooth on the front, calculus, additional missing teeth. There's so much that we have to look at and start considering in the data. So if we're going to begin to incorporate technology and AI effectively within our practices, we really have to begin to think differently about the data and the patient journey, because everything comes down to that data. But data management today is a diagnostic conundrum, like how we're storing so much data. It's in hybrid versions, paper, this, that, templates, in our heads. Every one of us is calling something a little bit different. So in AI, in the world of AI, there's this concept called GIGO, garbage in, garbage out. If we're not getting the correct data in the first place, how can we actually have enough data to be able to, the correct data for a system like this to be able to automate a task or utilize some AI model to be able to actually get the intended outcome that we're looking for again? So really, to drive data-driven decision-making and precision health, we have to begin to understand how important it is to document and collect data effectively. And so it's a hard thing to do. There's a ton of data we're looking at on every one of our patients. We need a system that allows integration for this data and also visualization. But unfortunately, today, most of the data sits in systems like this, which is our practice management software, or PMS, which stores the data but doesn't really store it always in a standardized way. It's in multiple areas and multiple clicks, and it's not easy to work with. And then on top of that, there's our dental philosophy. So every time you go to one of these continuing education institutions, we usually come back with more of these. So we come back with more forms, and now we're figuring out how to incorporate those protocols and those forms into our day-to-day practice or templates. So the thing is, the data changes at every recall. Data remains relevant only while the patient is our patient. If that patient moves from my office, say, to Dr. Mike's office, well, hey, they're no longer our patient, and he's got to start all over again. So this is the power of how AI can really start to analyze this additional data as it continues to be added and unlock the meaning of the important data to help us determine our differential diagnosis. But the process of decision-making is still always the intelligence of the dentist. The AI is really there to hold everything together in this crucible, connect the dots for us, and keep changing as the patient changes and as we learn more and want to incorporate more things in our practice. And that's the empowerment that can really change our dentistry. So I just stress this quickly because if we want to use AI tools, we have to really make sure that we're looking at the data side of it and how we collect the data, how we standardize the data collection is so important so that we can really begin to utilize tools in the future. So as we segue into the next doctor's, Dr. Kolbir here soon, I want to talk about what's
just to
important
warn
to
you
us.
before that's not me. Those muscles are just a bit more than what I can afford. So yeah.
So
Anyways,
to really drive precision and personalized dentistry, something that we believe that's core to us at ORAQ and many of the continuing education sort of philosophies out there is this risk-based approach to assessment. So we look at these 7 risk domains to really understand the patient, everything from how medical risk and sleep risk shape systemic health, healing, inflammation, and airway considerations, how occlusion and biomechanical risk tell us about the teeth, the joints, the load, the existing, and how existing dentistry will function over time. Caries and periodontal risk, it's talking about the disease activity, prevention needs, and long-term stability of the patient's overall mouth. And aesthetics is really what ties it together and showing what matters to the patient, visually and emotionally. But none of these risks exist in isolation. And that's why these little green arrows are on between there, because something that's going on in the medical risk is impacting what's happening in, say, occlusion risk or perio risk or sleep risk. So this is where things get complicated. And if we really start looking at it from a risk perspective, this begins to drive precision prevention and risk reduction, because we look at what are the key clinical findings that are contributing to a risk. What does this mean to me as a clinician, and what does this mean to my patient? So that helps us to be able to deal with this, which is we got to come up with a treatment plan. So what's urgent? What's going to come first, second, third? How do we sequence this? What maintenance intervals, compliance, you name it. But with risk, again, it's easy to look at it from a green light, yellow light, red light concept, because if something's high risk, we know we need to address it immediately. Moderate risk is, hey, this is the time to intervene early to prevent progression or major catastrophe from occurring. Low risk, let's continue to monitor and stabilize and keep them there. And patients understand this because nobody likes being in the red. So we've done some interesting research that we've published around machine learning applications to this risk-based methodology, and how do we correlate all these multiple domains and define and understand patterns, and also done some interesting research, all 3 of us doctors here, around one consolidated health score as well too. So we're really looking at this from a scoring metric perspective, and it helps us to really understand the story of the patient over time as well too. This is an article that was in the Journal of American Dental Association last year, just talking about risk calculators, something that's used a ton in medicine, but just not widely adopted yet in dentistry. And this is using risk calculators can really help us, understand where we need to intervene early, understand the probability of the outcomes that we're presenting, and so on. And it also becomes a great tool to talk to our patients about. And though it's not a crystal ball, it really enhances clinical decisions, and especially when things get complicated. So with that, I'm going to pass it over to Dr.
thank
Mahas
you.
here.
Thank you, Amrish. Basically, I agree with so much of what you said. And at the end of the day, it's a lot of us being practice-based people working in a clinic who want to show some value add for what they've done. So since I come into this field, it's been almost like a journey starting from the late 90s and seeing how dentistry has evolved and staying in tune with the evolution, like coming back to one of your slides, looking at what a PMS or a practice management software really does. I used to look at it more like a digital filing system. So back in 1999, we were all using paper charts. And then over time, we slowly evolved, but we haven't changed too much until in the recent little while, going from a digital filing system, let's say your PMS is ClearDent or Dentrix or whatnot, but trying to gain a lot of the access to all the knowledge that you have, all the metrics that we've taken, and to be able to package it for your patient, your client, in a very timely, succinct fashion where you also kind of avoid over stimulating yourself with always like recapitulating so much information. We see so many people during the day. There has to be a way to not only work smarter, but also to delegate those repetitive tasks. So that's why I really appreciate ORAQ and the group here of where they've let me come into the opportunity to actually start using that software, using an AI capable type of software to be giving more value add to my patients. So what I wanted to start with is a video just of what AI assisted perio looks like in our practice. Um,
545-535-434.
so that's a voice perio that we use. Basically just hitting sync because it took over in the clear end.
Dr. Madhouse, this is Tara. She's a new patient to our clinic.
Welcome to Calgary Perio. Why you're here basically is looking at our overall periodontal health. The referral was made for periodontal care. So your hygienist and your dentist are both focusing on areas that we can't reach that easily, especially areas that you can't see on your normal day-to-day. So what we've used here is periodontal probing, periodontal metrics, and I was able to analyze that through a few different results using ORAQ and also our software that allows us to show you some of the areas that we'd like to focus on. The options that we have right now are really leaning towards regular deep cleanings, and I want our hygienist to be on the same page. If and when we ever need a surgical approach, our hygienist would be able to give us a lot more feedback using some of these platforms that we're talking about. At this point, we have ORAQ AI up on the screen, and what it's showing you is stage and grade. So while we're at this page, what it's showing us here is the recommendations and our frequency of certain types of treatment. So I'll review each in detail and also have our hygienist on the same page so that we can actually communicate quite easily back and forth. So what that really shows is just like a clinical use of how we kind of push different types of infographics over to our team. And then also that allows us to use our hygiene or our periodontal workflow, giving that back to our patient. So as a visual representation of our mind maps or our mind tree, when we're looking at a certain amount of metrics, so I'm going to use probing depths and clinical attachment loss and mobility, furcation, tooth loss due to perio, a lot of factors and uh, the biomechanical and the caries rate. Now that I'm looking at ORAQ, I actually start widening my scope of vision. But periodontally, this would be a similar mind map where if then that. So if this, then that. So periodontal bone loss, periodontal pocketing, bleeding. What's the stage and grade? Is it stable versus active? If it's active, do we go into surgical therapy? So theoretically, what we're trying to focus on is how do we push this from being all in someone's mind or experiential to the next slide's going to show basically kind of like a functional loop. So I want to look at a patient in a pattern. That's where ORAQ gives us a lot of structure. But I had a seminar just a few months ago, and I have a fully kind of granulated seminar on how to create a pathway for treatment, what type of treatment, what adjuncts, and then all also reevaluating and figuring out at what point do you have to change modalities or possibly refer. But as a specialty practice, We usually don't refer other than externally to root canal or endodont, like oral surgery or pathology. But when it comes to a perio practice, I find that I want to define, predict, deliver, evaluate, and adjust. So my next layer is basically, well, what do you define? So the next slide here is showing you want to define a multiple layer of things. You have to, first of all, define your own principles. What are your principles? What are your principles for outcome? What's optimal outcome? I love reading, and two books that are on this slide here are how to actually create free time. So Jenny Blake, she basically has an excellent book, Lose the Busyness or Busy Work and Love Your Business. Principles provide the logic and heart of why and how we do things. So maybe 30 years ago in 2004, I start dental school and I was a lot more logical. I didn't have as much emotional intelligence, so my or emotional quotient. My EQ was quite low, but my ability to use logic in dentistry was, I thought, quite high. But living out of your brain is not the only way. I think building rapport, showing patients you care. So principles have to kind of be driven by what is your content and how do you bring that out to people. As a quick plug for Ray Dio, I just love the quality of life that people get from understanding life on larger layers, larger level. He has a great book called Principles. And he's an amazing investment strategist, learning about how to invest in yourself, if it's your health, if it's your work, also your own finances. I think it's all a large picture. If we play this small video here, this was us at the WTA, so a Women's Tennis Association. The tournament, beautiful day, and just to watch the finals, it's like wow, like to be able to put that much effort to be able to get there. There is so much riding on the base background of training and foundations and principles in general. So the next slide here, we're looking at, you still want to define. So in your principles, what are you defining? What is the optimal state of hygiene? Like if we're kind of centric now to perio, we want to have the ability to have measurable improvement, continuous measurable improvement, and I want that dentition, that periodontium to be stable. So to come back to it, are we just basically a standardized routine care, recall, rubber stamp, 6 months, 3 months, 4 months, whatever the number, 12 months, 9 months? Is it routine, repetitive, safe, very similar outcomes? We almost hit a ceiling. So my ideal is looking at the perio principles, a way of engineering a quality of life. I want to get involved with my work. I want to be involved with people that I care for. And in order to do that, you got to bring your passion into what you do. So I'm a pro health kind of guy. I love looking at the microbial kind of layers and talking about that with patients. So we're not just, hey, you need a cleaning, you need thorough and frequent decontamination and disruption of the microbiome. And then we want to create a customized perio plan for you. Do you use 3 month intervals with Hybenex on 3 intervals in a row? Occlusal adjustments. Do we want to start thinking of orthodontic alignment and possibly implant therapy very soon to be able to get improved function? So ORAQ AI opens up our eyes because we can't all be experts on every part of every field. But what it is we need people and software to be able to support our decision making. And that's basically where that digital filing cabinet has evolved from the PMS to something like ORAQ. If it's not going to be ORAQ, it'll be something else in the very near future, where we're getting a decision based tool to be able to help practitioners, whether you're in your third decade of work or your third year of work, but looking at how do you improve your optimal state, giving that to a patient. I literally get into all of this with patients who are good listeners, and it's trying to get that my point across. So coming back to it is visual with verbal. So if we could get those two V's, a lot of research shows anything between 15 to 40% improvement in case acceptance. So the next slide is basically just talking more about how do we define those metrics. What is our paradigm that we're looking at? Do we have habit versus precision? Do we look at just the biology, or do we look at the physics and biology? Do we look local versus systemic? That's where opening our platform of presentation, especially if you get trained in it, you start looking at systemic factors. You start looking at other oral issues. Maybe it's medical, something that I might have missed before. It's a lot easier for me to post-treatment review with patients as well. So there's a lot of data that we're getting that comes back to us and saying, hey, maybe it was the medical. Maybe why don't we recapitulate and then try something new and then keep changing small little details until we have that optimal state. I don't want to just get into see a back rubber stamp 3 months and that's it. If I don't see probing depths improving, I start saying, how do we make a positive change? So it's a pro mind or a pro health mind. It's really thinking about the patient's best interest. If you value health, which a lot of people do, I would really value the periosystemic link or the functional value of occlusion, just the mastication of the food bolus to get proper digestion. There is so much value in promoting dentistry in such a simple term to be able to provide patients with a better quality of life. So we're trying to engineer health. It requires a lot of information. It requires your baseline. It requires a prediction. You need to get out there and do stuff. You have to deliver your services. You also have to know what services to deliver. What new value add topics are there for you to review that weren't there 4 years ago or 3 years ago? If you don't have that relearning and lifelong learning capacity, I'm going to say a lot of practitioners are going to be left in a very small cycle of treatment provisions. So once you deliver, we need to reassess or measure. And then one of my mottos would be, you got to just pivot, or you have to figure out that where is your success and failure? Where's that loop really bridge? So the next slide, what I'm talking about here also is define the goals. You want to then take your goal and then you push that towards how do you predict where are we going to get to? So you want to have measurable values. Know that before. We are so well trained in dentistry, especially periodontics. Metrics out the paperwork is always always there. So there's no limit on paperwork metrics, but we need to know where we are, where the treatment is, know where you can go, and then look at that vision of where you want to go. We want to have things that are quantifiable. Think of augmenting your information, not AI being artificial intelligence, AI. I want you to think of AI as augmenting your intelligence or augmented information. What that gives you is it's not a replacement of you or your team members. It's rather the ability to work with more strength and even do less. Like sometimes it's not always do more. I'm not here to work smarter. Sometimes I just want to relax. So it's not, of course, I don't always want to work harder, but the goal is use the tools that are out there and maybe take some time off or enjoy a video or whatever, go shopping or something. But the long term is really how do you establish your target state? Coming back to what I really want to focus on is you need to create a goal, and that allows you to predict, can I get there? So when I see a patient, I want to reduce those pockets. I'm not going to be like, oh, hey, you got sevens, don't worry about it because I know you for the last 10 years. Sevens are no good. I want fives to tens, or if it's 14s or whatever, to be less than or equal to three. And if we can get there, great. With zero BOP, I want to see signs of health. If I'm unhealthy, I'm not just gonna sit there and say, okay, well, let me just always talk about unhealth every 3 months. I want to make some little adjustment if I can, and hopefully get to the next level. So really, it's creating success, it's stabilization of your health function, and it's trying to release, like what I want to emphasize here is don't have the burden of achieving success on yourself all the time, and trying to say, oh, I don't want the patient to be in pain or a financial issue. At this point, when some patient asks me, hey, is this surgery going to hurt? A lot of times I tell them, yeah, it's going to be uncomfortable for 3 or 4 weeks or 2 days or whatever the number is, but the value add is really there. And trying to get into a mindset or a paradigm that don't limit yourself by thinking a patient's not going to be able to afford treatment. Just provide them those options and let that person make his or her decision. We'll go to the next slide here. So why I look at simple clinical analysis here is we're always taking these metrics, probing depths, BOP, clinical attachment levels, recession, furcation, and radiographic bone loss. So the goal is you got your baseline. So that's your before. But I don't use my exam as anything more than a platform to say, this is where we got to go. Like I'm not going to be standard, like stable here unless it's perfect function, perfect reduced inflammation. At that point, I usually dismiss my patient. Like it's kind of like, okay, maybe that's when you're able to just get them on a really simple routine. So the next, like, so that's our clinical. So the next slide, we're talking more the human kind of like layers of, well, how do we get clinical attachment level, staging grading, grades A, B, and C? It gets a little convoluted. So what you can see the next slide, a picture form of that is what I usually show a patient. I say, hey, there's a human component to this. There's certain levels of breakdown, and here's a little bit more of an infographic, but understanding what the difference is between what I'd call slight, moderate, advanced, or stages two, three, stage one, two, and three are really working into a layer of at what point do we have certain insights that we have to start recommending? Like, what are we gaining for something? So that's where ORAQ starts pushing in a little bit more of a value add in the interpretation. So I'm not overwhelmed during a patient's exam by trying to calculate, okay, well, we've taken all these 30 teeth measurements and now we have 180 pockets, and how are we going to figure that out? So the next slide really shows a level of how do we look at driving the human side. So I want to also know, what does my patient want? What is their value? Right? Are they like just insurance driven, or are they health conscious? Does it take them a little while to talk it over with their peers or their spouses? What do they expect? Do they want something that I can't achieve, or are they here for some aesthetic or some other value that I might not be able to fully acknowledge or get to their level? So I want to spend time on getting to know my patient, not only just the metrics and the probes and the telling them, hey, you got stage three, let's do this. Like a lot of patients don't have a lot of value for that. They value what they came in for. They want to know what's their aesthetic satisfaction, what's their comfort level, what's their functional. Like so a lot of people, and I was just told this, that I prioritize function over aesthetics. And I'm like, yeah, sorry, but that was my wife saying that to me. But like when I'm talking about the backyard and stuff like that. But a lot of patients have different value adds. So if their value is aesthetics over function, great. That's not how I look at it, but I can't impose my wishes, my bias on them. So that's where ORAQ and a lot of patient management software, so it's not practice management software, it's like how are we managing our patients? I want to understand them a lot more. I want to build rapport. So what I've been learning over the last while is it's not the logic. It needs to come from logic and heart and the physical. Like it's just going to be a big picture. And by building rapport with your clients, you got to get to know them. You got to bring yourself, your emotions out. You got to show them you're approachable and understanding that the human side. So let's move to a video here. I think that might be the next slide here. So this is
My name is Shavinder. I've been a hygienist for the past 15 years. Dr. Ben has introduced me to ORAQ when I joined the team here at Calgary Perio, and it was very easy to pick up. When I open ORAQ, I'm able to see the medical history as well as all the dials that show me the periodontal history and the staging and the grading, and that's very helpful. It basically is another tool to help us help our patients, and it helps diagnose our staging and grading. That's, I would say, my favorite part of ORAQ is the staging and grading diagnosis. ORAQ has definitely made my morning prep faster. Previously, I would probably spend 5 to 7 minutes per patient, and that's cut down to 2 or 3 minutes per patient. Cuts down the time that I have to go through every patient chart, and just have everything clear on one screen makes it a lot easier.
So what that really shows is just practical information about how another tool, and I'm not trying to say let's complicate things. The value out of ORAQ is it's something called integrated into a PMS. So we use ClearDent, and I'm going to call it Streamline, with a internally driven patient information transfer to ORAQ. ORAQ now is able to use the value out of a lot of the patient metrics, the patient data, and present it back to our staff. And this is a hygienist that was just giving her point of reference, but also I use hygienists as something called a diagnostic facilitator. So we do a lot of exams and treatment plans through our hygienist for a lot of my perio patients. So really, it's understanding how to use current software, current tools to be able to bring more patient and treatment value. So before you even start any treatment, you're looking at hypotheses, AI enhanced prognosis, reviewing possibilities of future, and prediction. So just the next slide shows basically how a lot of the workflow shows up on a simple screen. And Mike's part of his lecture, Dr. Mike, is also showing an excellent video on how it works, not only on perio, but with the larger picture with restorative and occlusion and biomechanical. So it gives us a lot more tools. I'm also using other AI systems like Overjet. I use DiagnoCat and Denti AI. So I'm not technically an early adopter, but I really see the value of using help when I need it. And I definitely am a busy practitioner. We're very active, and it's something where I see the value of having a lot of this information processed for me so that I can really interact a lot more with what I want to do. And it's usually understand my patient. So the long term is just looking at what's the logic? How does AI or augmenting my intelligence really construct a lot of the treatment plan? How do I generate facial, like a visualization for the patient? So it's really improving that case acceptance and informed consent. So case acceptance is so key. We're always tracking those KPIs in our office. And it's showing maybe I'm hitting at 80%, but I'd like to be 90. Some offices are maybe 50%, and why not improve? So it's if you want it, you got it. And that's where I think that's Ariana, but I think that's also Perio. So if we go to the next slide, looking at what I want to do is talk more about like, hey, what's trending? And I'm talking about microbiome and I'm saying, hey, this is how we're going to decontaminate. So if I'm just probing and figuring out things like looking at a calculator, it's a little harder for me to really get into why am I here and what can I offer you after we've diagnosed you with gum disease or periodontitis or whatever the diagnosis is. So I just wanted to bring this because I'm quite passionate about the red complex, but theoretically, I really do think that periodontics is really revolving around biology-driven treatment plan, but it should be physics. But coming back to biology, it's not only bacterial, but it's also viral. So a lot of the newer trends are coming up where there's a viral route towards almost like a, a symbiotic for the virus and bacteria. So I guess it'd be like destructive biosis, where they work together to be able to create a challenge in a lot of the host cell. And that itself needs some more information to like, why do we not have periodontitis always treated with one gum cleaning? Is it because tissues have become super infected? Is it the physics? Maybe there's something with the occlusion, but we need to understand the biology and the principles at the end product for perio treatment. So if we get one thing out of this as well, on the clinical side, I would really start recommending hygienists and dentists start looking into the herpes viral and bacterial axis. So I am starting to give a 10-day Valtrix prescription, very simple, something like they'd use for cold sores, I believe. But if it's something that helps the viral, so technically a microbiome could have bacteria, virus, fungus, and amoeba. So I'm not sure what to kill an amoeba with, but at this point, we're really pushing the boundary on how to remove the microbiome and shift it back to health. So we're busy enough doing that, and that's where ORAQ really helps on the decision-making process, the clinical side, so that I can spend more time with my patient. It's really a structured data presentation, really understanding your areas in real time. So when I'm with a patient, I don't have like a 2 hour window. I have maybe like a 10 to 15 minute consult with me, and then chair time probably about an hour or less. So there might be a 30-minute window. So we're identifying those concerns in real time. It's a single view presentation. So that's where ORAQ gives us that retention from both verbal and visual. So we're really trying to optimize those repetitive tasks and build rapport. So creating a successful practice comes from patients liking you, from referrals liking you, from their families liking you. So it's really building rapport. So almost on that last visit, I'm going to show one last video. And this is just kind of a video if we had a little while ago. And this is just showing variables of the infographics. I had, this was ORAQ 1.0 back in the days. I have models, I have little brochures and pamphlets. I got a chair in the hallway in case mom and dad want to sit in there. We have a screen up on the top where we're showing x-rays. We have pictures. So ORAQ itself is really just one part of the case presentation, case acceptance kind of pattern. Connotations of gum disease. I'm basically explaining to this patient what I could with just like verbal alone, but I find that the verbal point of reference is just not as valuable. So if we get another golden nugget out of today's presentation, is that you're doing the best you can, but you need to motivate your patients by building rapport. If you build rapport, that's by taking your knowledge and your level of experience and building that bridge. So the next slide here is just really you want to deliver and evaluate your service. So as a quick plug to the periodontists out there, a lot of times you can't do any better when you're just scaling root planing because of this gingival phenotype. There's no algorithm that's ever going to replace the clinical practitioner. So what we're looking at is you need to have that feedback in the clinical artistry and saying, hey, look at those gingival phenotypes. You got clinical attachment loss. We want to create thicker tissue. Thicker tissue, thicker gingival phenotype creates better blood flow. Better blood flow is better for the clinical apparatus, attachment apparatus. So the capacity to do it all in one chair doesn't exist. You have to use tools, you have to have people supporting, software supporting. And then when you've reached your limit, adjust one variable. So just make that one change, pivot. And that's what I like to do. Just one pivot. If it's something variable A, maybe it's your tools, maybe buy that airflow, get that Hybenex. Maybe it's frequency. Maybe switch from 4 months or 6 months to 3. Maybe it's a certain type of other modalities, but frequency is excellent. And then maybe there's a referral. Calgary Perio is always open Monday to Friday, business hours. And it's something where there's a lot of really good practitioners. I love periodontics, but I also just love Calgary and I love work and blah, blah, blah. The issue is like we meet so many nice people out there. There's so many great patients, so many great colleagues, so many great coworkers that why not just keep working within your network and kind of as a segue to that, I'm just gonna say the next guy presenting, Dr. Mike, amazing. Just yeah, let's just start there.
Great, Kabir. Thanks for the intro there and great information. So go ahead, Amrish, and next slide there. So you guys have covered this well, that the idea of ORAQ as a treatment acceptance tool, just like we've had the different tools in the past, immunofluorescence and different tools, the DiagnoDent laser and different things that we've had in the past. Third-party validation is very valuable in clinical acceptance from a patient, because when patients hear that, hey, by the way, this software or this tool is showing us that you have decay or you have problems, they tend to believe that a little bit more, because they feel like sometimes dentists are trying to bill, it's a business, they're trying to pay for their rent, all of these things. And so you get a lot of patients that are very cynical about your treatment plan. Plus, as both presenters have discussed, in a lot of cases, patients have come from clinics that maybe have a lack of technology, and or they're so busy that they leave some of the smaller things because they just don't have time for it. They're not doing bite analysis. They're not doing sealants. They're not doing occlusal resins. They're not doing different procedures, preventive decalcification treatments, because they're just jammed. They're busy. They're full. And so you get a patient, as a new patient that comes from one of these clinics, and all of a sudden you start talking to them about all of these different things, a recession that surgery can be done on. And they're like, wow, the last 3 dentists I saw never said anything about that. And so sometimes when we come at it in a more comprehensive view, like looking at COIS principles and different techniques and knowledge bases like that, patients feel like we're overselling them or overtreating them. The benefit of something like ORAQ is it tracks all the patient's data, puts it into one seamless location, and it also, my biggest thing is that it tracks it over time. So is the patient getting healthier over time, or is the patient degrading over the time? And is there changes? And we have to remember, Rome wasn't built in a day, and neither is the patient's health. And as Dr. Kabir mentioned, just change one variable. So the data is going to be in front of you, and we're going to show a couple examples. So just look at, can you move the needle a little bit? Patient doesn't have to accept everything you offer to them that day. It's a work in progress. But the cool thing is we're going to be able to track that progress. We're going to be able to make small changes into the patient's health. Because the flip side of this is that if we make no changes or no improvements on the patient's health, whether it's home care, hygiene care, or dental care, then you're going to have that patient who's 25 years old with a class 2 div 2 bite that has all of their mamelons and all their teeth look really good at age 16, 17, 18, 19. But at age 50, they've ground down the back teeth, the front teeth are mobile, and we look at that and we go, hey, we should have done ortho on you 20 years ago, and now Kalbir's in his 7th decade of practice, and we should have done something back then. And prognostication is, I think, where AI is going to help us into the future. So Amrish, go ahead, pop to the next one. And so having this information where we can look at the patient's risks, and a lot of COIS principles and a lot of high-end occlusion analysis and principles went into this, and we're able to also allow that to be shared to the patient. So we're able to look at the risks, evaluate those insights, recommendations, and then we can actually send that to the patient, send them that PDF, say, hey, take a look at home, and they can share that information with their partner, because they say up to 40 to 50% of decisions on comprehensive dental care are done after the visit. They're done at home. So if we can provide them that information, that'll help. And let's go on to the next one. And so when we look at case acceptance as a continuum, we have lots of tools in our office today. Magical tool I still think is fantastic is that intraoral camera. You tell a patient they've got a cavity and you're able to show them that they have a cavity. And then you're able to then remove the decay and show how deep that decay went. And then you're able to put a beautiful filling in there. They go, okay, now I understand what you were doing. Now I understand what the value was. And I'm glad that you did it and I trust you. And what we're trying to do is build case acceptance, trust, loyalty, and looking after our patient. And as Kalbir said, creating that connection, that bridge to our patients. And when we look at this whole series of technology that are out there, CBCT, digital impressions, the PMS types, basic softwares, AI software is that newest part of it. And there's several out there. And, ORAQ is one of those softwares that's able to do that. Next one, Amrish. And again, with case acceptance, just a little joke here. How much do you got? And on to the next one. Or what does my insurance cover? That's what the patient says back. Now, the why with ORAQ is really this. Have we not heard this before? I went to 5 different dentists and got 6 different treatment plans. And that is because the consistency between dental offices and dental dentists is different. Now, all dentists aren't the same. All dentists aren't trained the same. But also there's many layers. The different demographics, different locations, dentists that are booked out 6 months, that don't have time for certain things, new grads that maybe aren't comfortable with modern technology. And so all of these things are skewing the patient's care. And what ORAQ is trying to do is make that more consistent. And that consistency is also driven into your own singular practice, because if you're on holidays or you bring an associate in, so you're only working 2 days a week, for example, you want there to be consistency. And I'll give you an example. You don't want a scenario where you've got a broken tooth that the patient says, oh, the dentist wants to crown this tooth. Can't I just do a filling? And the associate goes, oh, sure, we can fill it. We can fill anything. And then it just sort of took the wind out of the sails of that plan that was to get the patient to more stable occlusion, to get their bite more resistant to wear. And now all of a sudden we're patching again. And the reason is because that associate dentist didn't know what could be done. And instead, that associate dentist, if they with ORAQ, they would be able to actually look and see the risk and be aware of that prior to making that decision. And so that's where we can make a decision. Should a tooth be fixed now? Watch, patch it, or crown it. Next one, Amrish. And so we can make better decisions, improve predictive capabilities we have. Because sometimes, as John Coyce had said, this is a quote from John, conservative dentistry published a paper on this, may not be conservative. If we patch a crack on a tooth instead of full cuspal restoration and that tooth breaks in half, the question was it conservative to just patch up that tooth and not do the other work? Yes, it was cheaper, but was it conservative when the patient ended up losing it? And again, we stress that educating the patient with our technology and the third-party validation. Next one, Amrish. And just to give you an example, Kalbir talked about periodontal. When we built ORAQ, we built ORAQ on the literature that's in dentistry. We built it on the scales, the metrics. And so when we look at the PMS system, when we pull in the data, from anything that we can grab from, or we're able to get from the dentist or the other softwares, we can put it into these different scales, and we're running multiple scales all the time to give an idea of the patient's risk. And so Canberra is one of the big pieces that we're looking at. What's their home care? What's their care at the office? What's their status of decay, decalcifications? And we're looking at those assessments and looking at a product like Overjet or Pearl or Valmini software, where we can pull in those data points on percentage of decalcifications. ORAQ can track that and then follow that change over time and look at that. How does that affect the patient's risk? Next one, Amrish. And so just looking again at the caries and the perio, so the key things that we're looking at is what's being done at home, what's being done in the office, what are we doing to reduce their risk? And that's the same thing on the periodontal as we look at stage and grade. Stage and grade is a wonderful way to categorize our patients, not only medically, but also dentally. And then we can build that risk modeling from there into our software. And again, I stress with all of our models, we're able to track that over time and track changes over time, and also improvements so the patients can see improvement over time. Next one. And again, just to summarize on the Canberra risk, protective factors versus pathological factors, right? And that's going to be whether you're going to go towards caries or go towards no caries. And some of the things that we're working on at ORAQ is testing saliva, working with salivary testing companies, looking at xerostomia, trying to help our patients figure out ways to continue in this ever-changing environment of food with lots of sugars that we're being bombarded with, because that's the foods that are available to us that are inexpensive. Everything that's healthy seems to be way more expensive. So we need to find ways for our patients to help this balance. Next one. And again, as Canberra's recommendations, ORAQ's taken some of these plus other scales and is looking at the patient's risk, and then is making sure that we're advising both the patient, the hygienist, and the clinician, the assistants, this is what this patient should be doing. And I'll mention this right off the bat here. One of the things to think about is, as dentists and hygienists, we're busy. How many times have you gone into your operatory and you've had a patient going, "Doc, is there anything I can do at home that makes my enamel more dense? Can I use any products? Is there these hydroxyapatite products out there?" And then you're like, "Oh yeah, like there's MI paste, there's this, there's that, there's, Curodont, there's different things that are out there in the market, SDF, things like that." And now it's actually the patient that's asking us. And you think to yourself, wait a minute, why should they be asking us what they could be doing at home better? Shouldn't we be providing that information? Yes, it's great that they're asking, but what's happening there? And sometimes we're so busy, we forget to say, hey, and by the way, this would help you at home. And so if ORAQ can also be in the palm of the patient, so the patient can also ask ORAQ questions and look at their own health metrics, they can then also be an advocate for themselves on what they're doing at home. Next one. And so just a quick last video here that I want to show you guys. This is a patient where we looked at this patient, look at the risks, and I'm going to bring this patient in and we're going to do just a quick segment showing how I use ORAQ. And again, but this is that data that we're getting from ORAQ based on this patient's health history and medical data, and we're able to bring it together and helps us with analyzing our patient's risk. And that, again, in this case, we're looking at all of our risk models, including sleep disorder. How do they fit on that stop bang scale? Go on to the next one. So let's see that in action. Dr. Mike Parchewski from Terra Dental Care. And today we have a patient, Erin, that's coming in to see us for a checkup. And she's got a couple questions about some of the wear on her teeth. And also she knows that she needs a couple crowns. Prior to her coming in, what I want to do is I want to go to my computer software, ORAQ. ORAQ is an AI software that helps to bring all of her data into one place so that I can easily take a look and review the patient's overall health, all their dental risks, outstanding treatment. And so it gives me a good view to be able to see everything that's going on with Erin. So when she comes in, I'm prepared for her. So right now I'm going to take a look at ORAQ, and
I can see Erin's demographic information, her some information on her preferences, personal notes and information about her and things that she likes to do. We have her medical history, her medications, and all of those key things that are important as a dentist when we're working with our patients. And then I have all of the risk categories in the ORAQ software. I can look at her medical risk. I can look at, does she have any risk of sleep apnea? Also the biomechanical and occlusion risks. And we notice, like, for example, on the occlusion risks, she is a little bit high on the occlusion risk because she has some wear. She does report jaw pain and clenching grinding, and she has some recession on some teeth. And then I'm also able to take a look at some of her imaging. And so when I take a look at her images, for example, one of our key images here is she does have heavy wear on the right-hand side, and we can take a look, and that also shows up on her upper. So there we can see that clenching grinding, so that's important for us to assess. And then we do, again, we have a crown that has been leaking and she's due to have that replaced. One of those reasons may be because of that extra force that she's putting on that area. So we're going to talk to her about some of the different things that we see in her wear and tear, the cracking on this root, cracking on this tooth, as well as I mentioned, about possibly replacing that crown. So as you can see, I have Erin's risk categories up in patient-friendly terms so that she can understand which areas she's more at risk for. If I click on those areas, I can get the same insights recommendations in patient terms so that she can understand those better. I can also then take a look at photos, x-rays, and be able to bring those up in front. Hey Erin, how are you doing today?
Good, thank you.
Good. So I know you wanted to come in to talk a little bit about the teeth that you had planned for crowns. I know you've been clenching, grinding, the jaw's been sore, and you've been getting Botox for that. But I wanted to kind of go through from our software ORAQ. It kind of brings all of your data together so that we can have everything in one place, but also it highlights your risks. So it gives us an idea of how important is it to do treatment now versus waiting for the future, and what are the potential risks of waiting into the future, which could be like a broken tooth or something like that. Really, it's the bite and the bite issues and the risk of the cracks that has been focusing us more on why to do the crowns. So when I take a look at your biomechanical risk, you can see that we've got the 4.6 is planned for a crown. We're also considering the 3.6 for a crown where there is some cracking. So another thing we should probably do is also kind of assess, with your bite, can we adjust your bite or level out your bite a little bit so that it feels more balanced to you? So that's something that we can assess. So bringing this all together, it gives us a great idea of what's best to get done on you right now. Does that make sense to you?
Yeah, totally.
Yeah. So should we just go ahead and get that crown booked?
Yeah, that'd be good. Yeah.
Makes sense to me.
All right.
Dr. Mike.
Okay, Amrish, on to you.
Awesome. Thank you so much, gentlemen. Lots of deep and really good, thorough information. Just going to wrap up the presentation here in the last about 10 minutes or so, and open it up to any questions and things as well. So you've learned a lot about the clinical side of everything here, but I'm going to take it back a bit to the AI side of like how this all works. How do these models work? What are we doing inside ORAQ? And why shouldn't you just like query open solutions? Like, why not just take your x-rays and your photos and all the things that you saw both Dr. Perchitsky and Dr. Manas showing and just throw it into ChatGPT tomorrow? Obviously, there's the patient privacy and security side of it that I know we're all aware of, but you've probably heard of a term called a hallucination. And this is where, why and how models start to give outputs that aren't necessarily the correct output or aren't necessarily the exact reference to the knowledge bases that we talked about, when we're building a clinical decision support system. So a very easy example that I like to show when it comes to what is a hallucination. Some of you might have seen this example before, but it's where I queried ChatGPT to say, hey, I want to take my car to get a car wash, but it's only 200 meters away. Should I walk or drive? So ChatGPT says, well, walking is better for a multitude of reasons and all these different things. and it's going to save the environment, and you're going to get some exercise. And I said, but my car is dirty. And then it's saying, well, if your car is dirty, I guess maybe you need to drive it to the car wash, but the simplest plan still would be this, this, and this. And so then I said, well, how could I walk to the car wash to wash my car as you suggest, because wouldn't my car still be at home then? And then it's like, oh yes, okay, yeah, you're right. I understand. Thanks so much for giving me that suggestion here. So this is an example of just like a simple example of what a model hallucination looks like, and it's not really giving you the right output. And I had to prompt it multiple times still to try to make it realize something. So this is why dental AI companies exist, because what we do is we take these foundational models. Doesn't matter which solution is an X-ray AI solution, a voice solution, a solution like ORAQ, whatever it is, and then we actually put guardrails around it to help it answer correctly and make sure it's answering in the same way to give an output that would have a low, as least risk possible unintended outcome to a patient decision. And that's again why companies like ours exist, and why we spend so much time and dollars to build these types of things. So just thought I'd kind of share that so people understood what goes into model building, and why again to utilize solutions that are approved and regulatory approved as well. So what's in it for your dental practice? I hope you saw today some really unique and good applications that both Dr. Brzezinski and Dr. Menas described in terms of how you can really drive precision health, how you can really draw standardization in the use of risk assessment from a comprehensive patient assessment perspective, and also a communication perspective, so you can drive a better patient experience in case acceptance with full transparency to our patients. And I really believe the exam is the economic engine of the practice. And this is what clinical AI does. It turns the exam into economics ethically. So we're doing the right treatment at the right time for the right reasons. But if we drive better quality of care, we drive better diagnosis. We drive better diagnosis, we have better communication, better case acceptance. Case acceptance means, hey, we're increasing productivity. And if we increase productivity, we're increasing our bottom line. So these AI solutions can really help close this gap and help patients understand through all the visual examples that the doctor showed today, how we can build that trust with our patients and the rapport with our patients, and that relationship, have better understandings to improve follow through, and again, that communication with confidence. And with ORAQ, we've seen very interesting results where we're uncovering up to 2.5 times increase of treatment opportunities to really drive that precision prevention and early intervention care, and doubling treatment acceptance rates through what you saw today. So the lowest risk return on investment really starts in the hygiene chair, and the easiest ROI is right there, because if we can fill more hygiene openings from our existing patient base, get our patients on the right intervals, we're growing that bottom line in the practice, again, improving recare compliance, getting patients to do the right thing so that they're actually improving in health, surfacing the other opportunities, whether it be correct intervals for perio, preventative opportunities, restorative needs like Dr. Brzezinski was talking about with the cracked tooth and so on, and reinforcing the maintenance and disease control side of it with visual objective solutions to be able to help that, and really turn these recall and hygiene visits into scheduled treatment opportunities. So this is how clinical AI can really ethically show you how to drive better care and practice growth all at the same time. So to tie this all off again, it started off with a Kodak moment for dentistry. I hope you've seen today, solutions like ORAQ or how we're here today. It's really the time to learn about these things. All of you have given us some amazing time out of your busy schedules today to join us and learn about this. And it's the learning is what's going to start and build the future of us clinicians and as AI partners, and all of us working together towards being change leaders. We're at a very opportune time in our profession where adopting this technology now and being a part of it early allows you to be a part of shaping what the future of our profession and patient care truly looks like. So thank you very, very much. We appreciate all of the time again you've given us this evening. If any of you are interested in learning more about ORAQ with our partnership with Orem, we do have a promotion that we are offering to all the webinar attendees today, where your first 3 months of ORAQ would be at $150 a month. You can scan that QR code. We'll also follow up with an email with the booking link, so you can meet with our director of growth, Taryn, and actually book a demo and dive into more detail. I'm happy to talk about how we pull the data and sync the data, and and all of those types of things as well. So thank you all very, very much. Thank you, Dr. Manas and Dr. Perchitsky as well. And a big thank you again to Robert and Tanya and the ORAM team for the opportunity to spend the evening with you all.
Dr. Kana, Dr. Manhas, Dr. Parchewski, wonderful job. Thank you very much. I'm going to flip the tables and ask you some three rapid fire questions to kick it off. And again, just a reminder, Taryn and Tim from ORAQ are also on the call. And so we will be following up via email. But again, I encourage you to at least take a look at the trial offer and work with Taryn and the rest of the team to check out ORAQ. So if you may, now that we've got that up there, Amrish, I'm going to steal your screen share, and we can put it back up afterwards. And so what we're going to do here is I'm going to go right into here. And then I'm going to go some of our beautiful crown work. So first rapid fire question, and you can all do a quick 30-second answer, okay? What's the one advancement in dentistry you're most excited about that clinicians still aren't paying enough attention to? And you cannot say ORAQ because we know you love ORAQ. I'm going to start off, I'm going to rapid fire and say, Kobir, go for it. Tell me off the top of your head, what comes to mind?
I'm going to say a lot of patients are still really impressed with our use of radiographic interpretation. So that an advancement at this point. We used a system called DiagnoCat AI, and we were able to interpret CBCTs that were taken in office. We're showing patients a lot of their radiographs in real time, showing bone changes. So
Mhm.
it's a simple enough tool rather than me pointing at a little gray spot on
Mhm.
an X-ray. It's really interpreting data in a different way.
It's a great answer. As a non-clinician, as a patient myself, it's so helpful I mean, what? You want to cut open my mouth and do this and that? Well, why? Where are you? What are you doing? Where are you going with this? So those visuals are incredibly helpful from the patient's perspective for sure. So great answer. Amrish, what about you?
One of the things that excites me, actually, Todd and I got to trial this at your guys' Phase 4D clinic, is the jaw tracking. So with ModJaw, like being able to see how a system like that, they call it their 4D AI technology, where they're meshing an intraoral scan with a CBCT with your actual photos and video of your face and actually looking at jaw movements. Like this is I found was like mind blowing to really be able to see how we can track jaw movements, plan for cases from a digital articulation perspective. And we were seeing, I mean, jaw pressure in the temporomandibular joint and all these different things that like you cannot see any of that anywhere else. So that I think is
Mhm.
some really exciting, cool technology.
Awesome.
Sign me up. I'm joking.
Perfect. And Mike, how about you? What are you excited about?
So I will say that I do agree. Like from a big picture, the digital patient is an amazing thing. Okay, the what Amrish described, but I think when we talk about what clinicians aren't paying enough attention to, I'm going to say digital impressions. CBCT, intraoral photos, all of those records I showed, those are all important. But I think that still clinicians aren't taking enough digital impressions. You should be considering taking digital impressions on your new patients always, right? It's a great diagnostic tool, great way to track your patient, and it's a great thing to follow them into the future. And then you should be taking one every 2 years. And then, you can now on a lot of the softwares, you can actually compare how much more wear has occurred in that time. How much recession
Mhm.
has occurred? Is the recession active and we should actually get them to see Dr. Manhas? What is going on? Tracking your patients over time, I think, is going to be the biggest thing so we can actually intercept and get them healthier. And I think it starts to me with the digital impression.
Love it. Okay, here we go. Second one. Where do you think AI genuinely helps the clinician most, and where should it never replace human judgment? Kabir, you talked a little, you had a point in your presentation about this as well too. So, um, what do you think? Your take
To-
on that one?
So AI, if it's artificial intelligence or augmented intelligence, augmented information, it just allows me to build rapport That's all it's doing. So when I hear some people saying, well, a practitioner with a lot of experience says, "Oh, I don't need that software. I don't need AI to help me know what I already know." I'm like, "You're right, but the capacity of saying it will help you to present that case to your patients, to new patients especially, as a referral-based practice. I don't always have the opportunity to work on people like patients I've known for 15 or 20 years. Most of them are coming in for the first time or the second time, and they're just getting to know me. So it's really about creating a delegation of repetitive tasks so that I could focus on something that I find value in, of course, and that's getting to know the patient. And so AI will not replace me because I'm the human getting to know the other human. And even if it was a staff member in my clinic who is at the computer all day long, I will not replace him or her with AI. But what I would do is just let that person become a little bit more relaxed. Like we're so busy that to be a little more relaxed, a little more free time, maybe expand our profile, like just maybe grow. So a lot has to do with a clinician will always be a clinician, and a practitioner will always be there for that human side, at least until maybe Optimus becomes cyborgy kind of soft. So that's getting sci-fi. At this point, I really do think the clinician is just the clinician. Yeah.
Fair enough. Dr. Barczewski, Dr. Canna, any a different take on that, or do you agree with that?
Yeah, definitely agree. I think it's just like sniffing out the patterns, right? Like of the data, give me the meaning for the data. It doesn't matter if I'm looking at something operationally in my practice, and especially with patients, I don't want to spend time staring at a screen and trying to twiddle my thumbs around figuring and calculating something out. It gives me whatever information from an image, from the data we've shared today. It helps me do exactly what Dr. Manas described.
Love it.
Yeah, I
Dr.
agree with
P?
both. All I would add is that it also helps us to not miss things, right? Not make mistakes. We had a patient today, and they're like, "Oh, she just had the surgeon wants her on antibiotics," and the report had been sent and it wasn't flagged, and yet ORAQ had it up in its side, so it wasn't on the PMS, but because it was a document that was flagged into the health history, and the patient entered that data into the health history, then ORAQ flagged it. So that could have been someone who by their surgeon wants them to be on antibiotics, but we caught it. So I think catching things that we might miss and helping us to be better in relationships, reminding us that this patient's 3 kids are all in a sports camp this summer, so we can walk into that room and ask them about the sports camp, reminding us, what's happening in their health and what we did last time, so we don't have to read 10 chart notes. It's going to be just bringing that data to us so we can now have a better relationship with our patient.
Love that. All right, and Dr. P, while you're off the hot mic, I'm gonna keep you on the hot seat here. I asked you this question last week, so let's see if you can remember your answer or even top it. So I said, you have the entire dental world locked in a ballroom with you, and you have their attention for 30 seconds. What's the one message you're telling them?
My message would be prognostication. You need to understand your patient, recognize your patient's risks of future degradation to health, and be able to track that. So we need to know what is the cost of inactivity? What is the cost of watching and waiting? That's what we need to do. So we need to figure out if we take this patient and based on all of the data sets and all of the information we've got, that inactivity is going to lead them. This is what they're going to look in 30 years. The police take a picture of a person when they're 16, they've been missing for 20 years, and they do facial profiling to show them what they look like as an old person. Well, let's take our dental information and all of that information we have in dentistry, and let's figure out if we do nothing, What is this person going to look like when they're 50? Are they going to still have all of their teeth or not? And then how do we intercept that and make them healthier? That's the power of what ORAQ can do and what AI can help with clinicians.
Love it. Dr. Manhas, give us a pearl of wisdom for 30 seconds.
If I had the dental world in my grasp here, I'd always go back to one of my mottos or my mantra, and it's really know yourself or know thyself. And that looks like things on it creates a bigger picture and it looks at things on a different point of reference. The only way for me to bring my energy to other people is if I have some way of staying grounded or some way of having my core principles, my core values. So the more you can express yourself externally, you have to really know yourself internally. So everything I do is really grounded by I know who I am, and as I keep evolving, I get to know more of who I am.
Awesome. Thank you. And then last week, I watched Dr. Kana do a pitch to a tech group all about ORAQ, and he did that whole presentation you just saw in 4 minutes. So now I'm going to ask you to do it in 30 seconds, even more. So one pearl of wisdom, 30 seconds, go.
I think in the spirit of AI, I'd say again, just like being part of the change here. As Mike said, Rome wasn't built in a day. AI is here. It's not going anywhere. This is going to be a part of our future and the way we practice. So now's the time to understand it, be part of it. And, we as companies like us who are building and day in, day out, doing all this hard work, we can't make it better and make it perfect the way you want it until we have more and more people using it and giving us the feedback. And that's just back to the data side. So let's be a part of this future together. And that's the cool thing about innovation. And we can really build that village and that community together to drive the future of our profession and be a part of that.
Love it. Gentlemen, we are over time and dinner is ready for some of us. So I'm going to say thank you very much. And thank you for co-executing this webinar with me. And Taryn's going to reach out to the attendees, everyone who's registered, to gauge your interest and see how ORAQ can really be a fit for your practice. And with that, I'm going to say thank you very much, Dr. Kana, Dr. Manhas, Dr. Parchuski, for being here and for taking time out of your busy schedules. And with that, bid you adieu and good night. Thank you very much.
Thanks, everybody.
Thanks, everybody.
All right.